Welcome back to Senior Support on Your TV. I'm your host, Debbie MacDonald-Moynes. Our guest today is Barinder Gill from the Hastings and Prince Edward Ontario Health Team. Welcome back, Barinder. We've been talking about the OHT, or the Ontario Health Team, and I'm just wondering, now that we've covered off who's involved, and we've talked about primary care and all the health and human service agencies, even the police and municipalities being involved in this. I'm wondering, why do people think this is going to make a difference?
So I think, just lightly going back to what we had talked about, it was, I believe, in around 2019 when Ontario Health Teams were first announced. And again, since then, we've had now 50 plus teams that have been approved by the province. And these teams are seeing successes and have seen successes over the last couple of years, and including things like hospital to home transitioned. We've been able to strengthen our primary care connection through our primary care council with the OHT. We're working on improved digital health and virtual care access. And some of this work has happened throughout the province already. And just more meaningful partnerships and engagement with patients, families, and caregivers at a regional level. So that HPE level, that work wasn't really happening before, or if it was happening in a bit of isolation. And all of these gains that we've made as OHTs have been made in the face of or in the midst of the global pandemic that we still find ourselves in, and a lot of health system challenges that our hospitals have experienced, that our service providers have experienced. And I think seeing our OHTs and our OHT kind of rise to these challenges has made it clear that we're on the right track. And this vision of a more connected healthcare system, a more patient and client-centered system of care really is possible.
You know, Barinder, I've been working in the community for a very long time in my career. And during the pandemic, it would have been easy to feel very alone in the midst of all of the change. Things changed hour by hour some of the time, not even just daily and weekly. It was hour by hour. And I'd have to say, from my standpoint, having those meetings, and there were many, online Zoom meetings, we've all come to know and use Zoom all of the time, with partners in the health system, really did mean that we were all on the same team, that we were all working this through together. And I think it made it easier to find our way through the pandemic. You were there and with the OHT in Hastings and Prince Edward. What do you think about that part of it?
You're absolutely right, Debbie. And I actually had the privilege of being a part of it on the opposite kind of from a service provider perspective when I was with Addictions and Mental Health Services. And I think one of the very first initiatives within our OHT was bringing together service providers from all sectors in healthcare, community, and human services to address COVID-19. And I remember being a part of those regular meetings, and really the messaging that came out of those meetings is we're all in this together. We all have resources that we're able to leverage. We find ourselves in a global pandemic, and it's best to have a region-wide strategy in how we're going to respond to the pandemic and how we're going to recover as well. And we work on that recovery, kind of addressing COVID-19, but focusing more on our recovery efforts as we see kind of the light at the end of the tunnel.
Yeah, I think that's an example of one of the early collaborations. The Ontario Health Team was set up just before the pandemic, and then really had to keep going during March of 2020 and onward. We all just had to keep going. So that's a great example of one of the early collaborations. I'm wondering, have there been other collaborations? You could give us some examples.
Absolutely. The most recent example, and many of the viewers may have heard of our COVID-19 cold and flu care clinics that are now operational and will be operational hopefully until the end of March. And again, that's bringing together service providers. That's bringing together community health centers. So we have our Belleville Quinte West Community Health Center. We have Gateway Community Health Center in Tweed. We have Prince Edward Family Health Team, and then Quinte Health as well, along with Hastings Quinte Paramedics, amongst a myriad of other service providers that have launched these clinics here in Hastings County and Prince Edward County with the support of the provincial government. And it's to the strategy behind or the goal behind these clinics is a bit twofold. It's to ensure that our patients and our clients and our communities have access to the right care at the right time in the right environment, but also making sure that our hospital resources are being kept for those who really need that emergency hospital-based care. So it's a bit of an emergency emergency department diversion strategy, or ED diversion, as it's commonly called. And those clinics, again, are now fully operational. They're fully staffed. And again, they're providing care to people who may not necessarily have a primary care provider, or folks who may not be able to access their primary care provider in a timely manner. So those services are there, and that service is brought to our communities as a result of this partnership. So
Yeah.
that's another one.
Yeah, it's a really good example, I think, and it's time limited, isn't it? Because it's during the respiratory flu season, because people just don't sometimes know whether or not they have the flu or some sort of a other type of respiratory illness, or is it COVID? And if they all go to the emergency department, that clogs things up there. So I just, on the outside looking in as a community-based partner, thought, wow, this is wonderful. These health agencies got together very quickly. It came together and established these clinics that will be in place until the respiratory season is over.